32-year-old Rebecca Grundy is beating the odds.
It's almost 4 years to the day where I woke up on a stretcher in a hospital hallway after suffering from 3 grand mal seizures.
The cause, a grade 4 glioblastoma, an extremely aggressive form of brain cancer with one of the lowest survival rates, typically less than 18 months. It's most commonly seen in adults over the age of 45. Grundy was just 28 when she found out about her tumor, and in Ontario, the drug she needed to survive, an at-home treatment called temozolomide, isn't covered for patients her age.
I would have to jump through all of these hoops as a young person under the age of 65 to get access to this treatment that is supposed to kill the cancer cells and save my life. And that's just not fair.
Grundy spent weeks waiting for provincial assistance, time many of these patients don't have.
That's the most devastating situation when the most effective, the most convenient, the best tolerated treatment just no longer becomes an option, and we have to use an inferior treatment with more toxicities.
In Atlantic provinces, patients face a similar patchwork of drug coverage. Meanwhile, in Quebec, private or public insurance will cover the cost. And in Canada's western provinces, take-home cancer drugs and hospital-administered cancer drugs are treated equally. This means most patients get the medication doctors prescribe them immediately. But even that access comes with caveats. 36-year-old Megan Goet was diagnosed with stage 4 breast cancer last year. She was prescribed Lynparza, another at-home medication with less severe side effects. But in Alberta, the $8,500 a month cost is only covered for ovarian and prostate cancers. Without her husband's private insurance, the mother of one says she likely wouldn't be alive today.
I was really scared that I wasn't going to be able to see him graduate kindergarten thanks to this drug, and how amazing it is working for me. It has extended my longevity by quite a bit.
At Ontario's legislature, there have been promises of policy change, but no immediate action.
We're frustrated. We had hoped that our cancer care system would have evolved and tried to keep pace with how cancer treatment is changing.
Advocates say this should also include speedier approvals from Health Canada, keeping pace with developments south of the border.
During the pandemic, we were seeing young people with aggressive breast cancer crossing the U.S. border to try to access treatment because the stakes are so high.
Grundy, a lobbyist, is focusing on her province, pushing Ontario's health ministry to do better for other patients.
It's important that these people have the best shot at life.
Fighting not just for her own, but for everyone else who will need treatment, regardless of age. Jamie Mauracher, Global News, Toronto.